Age-related macular degeneration, or AMD, is a degenerative disease of the photoreceptors of the central portion of the retina, or macula, and is classified as either dry or wet and affects an estimated 8 to 9% of the population worldwide. Now, dry AMD, or non-exudative AMD, is the more common form, affecting about 75% of patients with AMD, and it's characterized by round yellow deposits of lipid-rich material in the retina called drusen. Wet AMD, or exudative AMD, is characterized by new vessel formation in or under the retina, and these new vessels tend to leak fluid or blood, which collects in and beneath the retina, resulting in this macular degeneration. Now, some non-modifiable risk factors for these conditions include age and genetic disposition, and some modifiable risk factors include smoking and diets low in antioxidants. Now, initially, patients may be asymptomatic, or they may present with problems adapting to dark environments or contrast sensitivities, and as the disease progresses, we will note the common decline in central visual acuity. AMD is diagnosed clinically through history, visual symptoms, and a dilated eye examination using a slit lamp instrument. In dry AMD, we will see those drusen that I previously mentioned, patches of atrophy of the retina or areas of depigmentation. And in wet AMD, a dilated eye exam may reveal subretinal fluid or hemorrhages, and these look like a grayish-green discoloration in the macular area. Now, these patients require an urgent referral to an ophthalmologist trained to treat wet AMD. In dry AMD, treatment may consist of vitamin supplementation. However, real benefits from this type of supplementation may only be seen at the initial stages of the disease progression. These vitamins are things like vitamin E, vitamin C, zinc, and copper. First-line treatment for wet AMD is, let's see if I can get this right, intravitreal vascular endothelial growth factor inhibitor. However, again, this will be managed by an ophthalmologist. And once AMD is detected, self-monitoring with an Amsler grid weekly is one of the best ways to detect disease progression.